Hello and welcome. Today, we're diving deep into a condition called Barrett's esophagus. It's a change in the lining of the esophagus that can have significant implications. We'll explore what causes it, how it affects your body, and what you can do about it. So, what causes Barrett's esophagus? The primary culprit is long-term, chronic gastroesophageal reflux disease, or GERD. GERD occurs when stomach acid frequently flows back into the esophagus. Over time, this repeated acid exposure damages the esophageal lining. While GERD is extremely common, only a small percentage of people with GERD develop Barrett's esophagus. The precise reasons why some individuals develop it and others don't are still under investigation, but genetic factors and lifestyle choices likely play a role. Let's understand what's happening inside the esophagus. In Barrett's esophagus, the normal squamous cells that line the esophagus are replaced by columnar cells, similar to those found in the intestine. This change is called metaplasia, a process where one cell type transforms into another. This transformation is the body's attempt to protect the esophagus from the damaging acid. However, these new columnar cells are more prone to developing dysplasia, which are precancerous changes. And that's where the concern comes from. These dysplastic cells have the potential to develop into esophageal adenocarcinoma, a type of esophageal cancer. Barrett's esophagus affects approximately 1 to 2% of adults in the United States. It's more common in men than women, and it's more frequently diagnosed in Caucasian individuals. The risk increases with age, typically affecting people over 50. However, remember that many people with Barrett's esophagus don't even know they have it because they may not experience any noticeable symptoms. The symptoms of Barrett's esophagus are often similar to those of GERD. These can include frequent heartburn, regurgitation of food or sour liquid, difficulty swallowing, dysphagia, chest pain, a hoarse voice, and a persistent cough. However, it's important to note that many people with Barrett's esophagus have no symptoms at all. That's why regular checkups with your doctor are crucial, especially if you have a history of chronic heartburn. Diagnosing Barrett's esophagus requires an upper endoscopy. This involves inserting a thin, flexible tube with a camera down your throat and into your esophagus. The doctor can then visualize the esophageal lining and look for any abnormal changes. If suspicious areas are seen, a biopsy will be taken. This means a small tissue sample is removed and examined under a microscope to confirm the presence of Barrett's esophagus and to determine if any dysplasia is present. Barrett's esophagus is often classified based on the presence and severity of dysplasia. It can be classified as non-dysplastic Barrett's esophagus, low-grade dysplasia, or high-grade dysplasia. The classification is based on what the pathologist sees when they examine the tissue biopsy under a microscope. Non-dysplastic means no precancerous cells are found. Low-grade dysplasia indicates some precancerous changes, while high-grade dysplasia suggests a significant risk of progression to cancer. The treatment for Barrett's esophagus depends on the severity of the dysplasia. For non-dysplastic Barrett's esophagus, the focus is on managing GERD with lifestyle changes, such as avoiding trigger foods, losing weight, and elevating the head of your bed, along with medications like proton pump inhibitors (PPIs) to reduce stomach acid. For those with dysplasia, additional treatment options include endoscopic ablation therapies like radiofrequency ablation or cryotherapy to destroy the abnormal tissue. In cases of high-grade dysplasia, surgical removal of the affected portion of the esophagus, called esophagectomy, may be considered, although it's less common due to advancements in endoscopic treatments. Preventing Barrett's esophagus primarily involves controlling GERD. This means adopting a healthy lifestyle, maintaining a healthy weight, avoiding smoking and excessive alcohol consumption, and working with your doctor to manage your GERD symptoms. Early detection through regular checkups, especially if you have chronic heartburn, is also key. The prognosis for Barrett's esophagus depends on several factors, including the presence and severity of dysplasia and the individual's overall health. Early detection and treatment significantly improve the chances of preventing progression to esophageal cancer. Recent research is focused on developing more effective and less invasive ablation techniques, as well as identifying biomarkers that can predict which patients are at higher risk of developing dysplasia and cancer. Gene editing techniques are also being explored for future treatments. Continuous monitoring and follow-up are essential for individuals with Barrett's esophagus to detect and treat any changes promptly. Thanks for joining us in learning about Barrett's esophagus.